Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices in Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning.
Tom, we've been doing a little sequence here on aid and attendance, the VA benefit for assisted living and in-home care. But there's also a perception among the military veterans that they don't need to worry about long-term care because they're going to go to the VA nursing home.
Exactly. And so one of the big perceptions was, oh, Medicare will pay for my nursing home. And the other one is, oh, I was a vet, I'll just go in the VA. But the reality is it's a very limited benefit for a very select few vets.
So as we talk to vets, first of all, even the ones who are eligible for it, you know, they're not in the immediate area right now. You know, from our area, you're probably close to an hour drive to the closest one, and most vets are saying, well, really, I prefer to be closer to my family. The family's saying, I would prefer that that person be closer to me. And so, first of all, right out of the gate, logistically, for many people, it is just an unacceptable alternative.
Exactly. One of the big drivers of quality of care is, you know, having your family be there. But if if your spouse has to drive an hour to West Virginia or up into the hinterland in Pennsylvania, it's a bad situation.
You know, and say what you want, it's no secret that the VA is not operating on all cylinders right now. I'm not sure that anybody has any business aspiring to that anyway.
Yeah, you can get some closer custom care at a higher level in many cases, although there are a lot of families that are very happy with the VA nursing homes in the care.
Well, the next issue that you have here is the basic rule of thumb that we have heard from the VA is if you don't have a 70% service-related disability, you're not going to qualify to go into a VA nursing home.
And that's a good point. So you've got a 20%, 30, 50, you're in line behind a lot of folks with 100% service-related disability or not, and so on. And so the odds of getting in go down dramatically.
Well, and what we're also looking at and saying is that the VA, in no manner of speaking, is prepared to accept every veteran who needs nursing home level of care into their nursing home. So they have a significant selection criteria, which really means most people, it is not going to be an option.
Yeah, and even if you are in line, it may take months, if not years, to eventually get there. And if you need immediate care, it's just not a good opportunity.
You know, we see from a practical point of view that most of the people that we're dealing with that end up in a VA nursing home are coming out of the VA hospital. And so they're frankly, just as every other hospital in America is saying, we need to get them out of the hospital, we need to get them into a skilled care environment, are frankly looking at discharge from their own hospital first.
Right, and they're going to look there first for the admission. So if you're in a private hospital somewhere in Maryland or Pennsylvania, your odds go down significantly.
And then you combine it with the fact that in the past we used to see these 30-day contracts, and they would sometimes do 2 or so, but we're really not seeing those these days. I'm not saying they're not in existence, but we're just not seeing the VA very active in the long-term care environment today.
Yeah, and that's a good point because, it used to be a good feature, or at least a temporary feature while you figured things out. But again, if they're drying up, it's just fewer opportunities for vets.
There is an economic advantage to it. We do acknowledge that. Many times in the Medicaid system, we can create comparable opportunities to protect resources for married couples. The VA is clearly preferable for a single person, but you put all of these other limitations in there, it does not tend to work that often in our practice.
Right, and it really is trying to find that needle in the haystack a lot of times. Sometimes there's openings and you go right in and it's an excellent opportunity for the family and they're able to deal with the negatives, but they're becoming more challenging opportunities.
And part of it is that, you know, we just have a huge number yet of World War II veterans that are nearing the end of life. We have, you know, the Vietnam era veterans are also getting quite old as well.
Right.
And as a result of which, there's just way too much demand for a very limited number of beds.
Yeah, and so people with that thought that, oh boy, that's going to be the answer, really are being disappointed.
Tom, as always, thanks for taking time to appear on the program.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance worries to us. Write Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Double Save Fiery Funeral Home. We care.
Call Ed Lowe to help put your mind at ease.
Welcome to special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. With me today is Matt Hurley from Hurley Auctions. Welcome to the show, Matt.
Thanks, Mike. Good to be here.
Now, Matt, some of our viewers are surprised that we actually do this on tape, but the reason I'm going to mention this today is today it's snowing outside.
Yeah.
And so that would be the kiss of death for an auction if you did it the traditional way.
It would be a rough day.
That's right. And you know, people just kind of look out there and say, you know what, maybe I'll wait next week and hope we have a good auction next week.
You know, I look forward to snow now. I don't like snow, but it sure helps my auctions.
All right, well, let's talk about it. You know, obviously when you do real estate, that's done on site. There's just no other way to do it. But a lot of personal property today is not done on site.
Yeah, almost all of our auctions are online only. A few years ago, we had a giant blizzard, one of the best auctions we ever had. Everyone was home. They could bid from their living room, they could bid from their phone, and so it's changed everything.
And you know, what we found was the lawyers handling estates or downsizing people's homes, you know, there was basically just 3 months under the old that we just shut down because we just could not deal with the risk of a bad weather day.
From the middle of November till the middle of January, I did about 3 auctions before. Now I'll do 30 or 40.
So, you know, one of the things that's beautiful about your situation, it's 7 by 24, rain and shine, and how many qualified bidders do you now have on?
We are headed to 19,000.
And so that means that people also get accustomed to dealing with you, and I'm sure that your demographics suggest that once somebody registers, they keep coming back.
They keep coming back. They do. They do. It's amazing. We can't believe what we've seen.
And so, and the beauty of it is too, is that you don't have to just hang out. You can actually structure some bidding in there to your max and then take a walk.
The thing that people like is they're busy. They don't have time to sit at an auction all day. They want one item. They can log on, they can bid, it takes 30 seconds and they're done. If they want to sit and watch it, they can, but they know what time to be there.
But they could also even put some structured bids in.
Oh, absolutely. They can leave their bids and go about their day. The computer takes care of it for them.
All right, now, we have a rule, which is?
Don't throw anything away.
And thematically with this show, we say, this means you.
Yeah.
Don't throw anything away.
Don't throw it away.
And so, you know, we have stuff here that we're going to talk a little bit about, but, you know, we just have sold stuff in the past that people just cannot believe. You know, sewing patterns, prom dresses, stuff.
Thousands of dollars for things that were headed for the dumpster.
All right, so we're going to have a little bit of fun today. Now, first of all, you also tell people don't move it. Now, what do we mean
That's
by
right. What our problem we have now is we do it all online. We just photograph it and leave it where it is. And they'll try to help me take everything out and set it on the bed or set it on the table. Just leave it where it's at. It's the best thing they could do.
Oftentimes characterized. I have some nice artwork, nice mirrors. Where are they worth the most?
They
Hanging
look
on
best
the wall.
hanging on the wall.
All right,
That's
so
right.
let's just kind of work through this. Now, obviously, this is in Grandma's kitchen, should be thrown away, right?
You would think so, but this is an old spice tin. The spices may not be good, but the tins are valuable. And they'll sell for $5 or $10, but if you have a cupboard full, it really adds up.
Yeah, the old Dirksen thing, $1 million here, $1 million there.
Yeah.
Next thing you know, you
Same
have
thing.
$1 billion.
Yep, another cinnamon tin, and they just do very well. So something you do not want to throw away.
All right, now, obviously you throw these things away,
You know,
right?
these are things that people see and, oh, that's Grandma's old flour sifter. They are now being decorated with. People don't use them, but they decorate their kitchens, they decorate their homes, and so everything on here, you won't see people using it, but they'll decorate with it.
All right, so what might this be?
$10, $15, $20.
All right. Now, this is actually a beautiful
It's the
looking-
granite-ware coffee pot, and again, another $15 to $20 item that you don't want to throw away. So if you think about it, everything on this table is a couple $100 if you add it up. And that came out of Grandma's cupboard, one cupboard.
All right, now.
Oh, I love
I don't-
these.
what are the cookie
I love these.
cutters, or-
It's a rolling cookie cutter,
Oh,
and then we
yeah.
have some red and green handled utensils, and they are really hot right now. Anything red, green, people really like those. They like to decorate with them, and so they're going to bring $3, $4, $5 a piece. But if you have a drawer full, it really adds up.
I always just find this stuff amazing.
So just some neat choppers, cutters, but again, that's before the day of the Ninja processor, and so that was Grandma's Ninja cutter.
All right. Now, this looks to me like a refugee from IHOP. I hope we're not going to create a run on going to
not from
IHOP.
And so, but just another little syrup container, but it's red.
Right.
And so that red, the green, it's what's popular right now and people want to buy.
How about these bowls? Obviously.
Okay, these are just getting better and better. I remember when they used to sell for $20 or $30. They're now bringing $50, $60, $70, $80 for a nest of these bowls.
Wow.
Don't throw them away.
Don't throw them away. Now, obviously, this is kind of a cool piece.
Oh, that's cool. That's an egg scale. It tells you what size egg you have. And so we find these in a lot of homes, and probably a $30 item, $30 or $40.
All right, and then.
And finally, this is part of a refrigerator dish set. They used to put them in the refrigerator to keep things in.
So this was a
And
Tupperware equivalent.
This is before Tupperware. Yep, that's before Tupperware. And they bring, for a set, they might bring $20, $30, $40. Mike, I couldn't resist bringing this today. It's a piece of Longaberger pottery. And in the past, we've said how Longabergers, they're not selling, how it's hard to sell. Believe it or not, it's changing. And so it's funny how these things change, but my understanding is Longaberger's closed, and now baskets, I just sold about 200, and they sold great. And so I apologize for all those. I said, your baskets aren't worth anything.
We used to tease it.
They're
kindling.
selling, I know. And so in the past 2 months, we have seen a revival of Longaberger. So who knows how long it'll last, but they've been doing real well.
So don't throw it away.
Don't throw it away.
Don't move it.
Mm-hmm.
And
Leave
how
it where
can
it's
they,
at.
And how can they get a hold
They
of
can look on our website at hurleyauctions.com or give us a call at 717-597-9100.
Matt, it's always fun having you here.
Thanks for having me.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
Guys, I thought you were supposed to be working in the yard.
If you haven't visited HurleyAuctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at HurleyAuctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Dr. Wayne McWilliams, urologist, the Urological Center at Robinwood. Welcome to the show, Dr. McWilliams.
Thank you, Mike.
You know, we talk about and we hear about prostate cancer all the time. Tell us a little bit about its incidence.
Right, prostate cancer is a very common disease. It's the most common cancer in men over the age of 50, and it's the second leading cause of cancer deaths in men behind lung cancer. And about 1 in 7 men during their lifetime will be diagnosed with prostate cancer, and approximately 30,000 men each year die from the disease. So it is pretty important.
Well, and my understanding is like many other cancers, the earlier that it's diagnosed, the better the prognosis is.
Yeah, that's very true. Early on, prostate cancer, like other cancers, may not have any real symptoms, and so we do think early detection by getting checkups. The main ways that we find out about prostate cancer are, one is a blood test called the PSA test. That's very helpful. If that's elevated, that can indicate that there's a problem. And the other thing is a digital rectal exam, which is done by your primary care provider, or urologist do that, where you check for an abnormal spot on the prostate. And if you have either of these are abnormal or elevated, then we usually proceed with further testing and biopsies of the prostate to confirm whether or not the patient has prostate cancer.
All right, we're going to ask Director Gregg to pull up a picture here. And so this shows the prostate then, and then I got the picture on the side. It shows how a tumor might manifest itself.
Yeah, the prostate's a gland. It's about the size of a walnut, and it sits beneath the bladder in front of the rectum, and the urinary channel goes right through the middle of it. And it produces fluid that helps to support the sperm, particularly when it goes in the female reproductive tract. And kind of after, a couple is past their childbearing age, it's a little bit like the uterus. It doesn't have a whole lot of purpose, but it can cause problems down the road with enlargement or cancer developing.
So I gather that rectal exam, we saw the tumor in that picture. Is there a change of density or a lumpiness?
Yeah, you can feel like a hard spot or a nodule. It'll just feel abnormal, and so we do still think that the digital rectal exam is very important.
And a low PSA does not necessarily mean you don't have prostate cancer.
That's true. Sometimes that'll be low, but there'll be a nodule there, and that could be positive, and vice versa. The prostate may feel totally normal, but the PSA is elevated, and that could still indicate prostate cancer. So both together are pretty important.
All right, so when would you suggest that people routinely be screened?
Yeah, my feeling is that at age 50, all men should be checked. Now, there's some higher risk categories, men that have a family history of prostate cancer, or the African American community. In those men, we suggest at least by the age of 45 to get their first check.
All right, and so as you said, that could be done by a urologist, but also primary care.
Primary care, that's true.
All right, and one of the great changes has occurred that, some of the early treatments, much the same as like with breast cancer, were pretty drastic, but there's a lot of things going on now.
Yeah, things have improved. There's a lot more options out there now. We do still think in early disease, either surgical removal of the prostate or radiation therapy, both of those are quite effective, but they are doing things now that minimize the side effects so that there's not as much a problem with urinary incontinence or erectile dysfunction following the treatments.
And so you're going to sit there if there's a diagnosis, you've had that screen, there's a diagnosis, and particularly if there's an early detection, you're going to have a sort of a broad base of various options available to you.
That's very true, Mike. As I said, there's surgery, radiation, cryotherapy, which is freezing the prostate. Some of it too depends on the age of the patient, what other medical comorbidities they have, and the stage of the disease, whether it's localized or more advanced.
Well, Dr. McWilliams, how could somebody get a hold of you if they want to find out more about it?
Yeah, we're over at the Robinwood Medical Center. It's called the Urological Center. It's Suite 228 in the green entrance, and we're happy to see anybody, and we have a staff there, and thank you for having me on the show today.
Thank you for coming. More from Contemporary Retirement after these messages.
The Community Foundation strives to be a forward-thinking organization.
We are assessing needs, working with donors to see things differently,
so that Frederick County can be its best. It's a wonderful place for all of us to live, work, and play.
We look forward to addressing the future needs of the community.
Visit frederickcountygives.org and learn how you can start to see things differently too.
Albright, Crumbacher, Mal & Eitel are a full-service firm that provides elder care services including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on Contemporary Retirement. Making Sense focuses on the financial issues affecting the retirement community. With me today is David Twenhafel, Senior Vice President at the Family Heritage Trust Company. Welcome to the show, Dave.
Thanks, Mike. Happy to be here.
Yeah, Dave, you and I in a long ago time, stealing a word from a certain movie,
Right.
When we looked at insurance companies, we were looking at insurance companies, particularly life insurance companies, to provide coverage, that was not difficult to figure it out. And most of the time we only had two products. We had a term insurance policy, which was for a limited time, it provided coverage. And then we had a whole life product, which was designed for a long period of time. Not too difficult to figure out their products.
Right, exactly right.
But then the insurance companies started getting into the investment business. And the irony is that they use a contract, which is a life insurance contract, but is in fact not life insurance.
Well, there's life insurance to it, but really it's an investment product, and the life insurance in some ways is almost incidental to the investment part of it.
Well, in fact, they have to use that contract because there was some benefits internal to a life insurance contract that allowed the earnings to be deferred and not recognized currently. But even though it says it's a life insurance contract, I hate to glaze over the eyes of our viewers, but the IRS created a test called a modified endowment contract, which was to determine whether or not life insurance was actually life insurance or it was an investment product.
Correct. Right. And we always warned people you didn't want your life insurance to go non-MEC, we called it.
Meaning it was taxable, and so the reality is that you looked at these things, you had to pay attention, and you say, well, what could be the difference? Well, if you give a life insurance company $50,000 and they give your money back with interest, that's not life insurance. That's just a return on your investment.
Correct. Yeah, that's a pure investment, really.
And whereas, if you want to understand what life insurance looks like, the easiest way to see it is a classic term policy. You pay them $100 a month. They promise to give you $100,000 if you die. It has no cash value associated with it at all. And there's no question that that's life insurance. It's not an investment.
That's the purest form of life insurance you can get. It covers you for a certain amount of time at a certain price.
And the receipt of that death benefit was tax-free and continues to be tax-free.
Correct, yeah.
Whereas in that investment product, it comes back out as ordinary income to you.
If it's life insurance or an annuity and you take it out while you're still alive, then yeah, the money you make on that is taxable and taxed as ordinary income, which is taxed at a higher rate than a lot of investment gains really get taxed at.
But this is the problem with that investment account. Because it's deemed to be an investment, not life insurance, even when you die, that death benefit, if there is a death benefit or improved return on that, goes to your heirs and it's taxable.
It's right, for an annuity that is a taxable event to your heirs.
And so as a result of which many times people are sort of mixing up the concept of thinking because it's a life insurance contract, therefore the benefits are tax-free. And the answer is it depends on whether the IRS has determined that investment to be an investment contract versus a life insurance contract.
Yes, and that's a distinction that your average person doesn't pay a lot of attention to, and the tax consequences of that can be pretty significant.
Not only that, but because that income has been deferred, the IRS says it's ordinary income no matter when it's taken out. And so people are oftentimes confused that an investment in the stock market, if it were not embedded into that life insurance product, would get capital gains tax treatment, and the tax would disappear upon it going to the beneficiary.
It's step up in basis is what we call that, and you can get that, but not inside a life insurance policy.
And so people, we oftentimes see that people, as they're looking at stuff, they're hearing descriptions of this stuff, they're not really realizing that there's several different concepts being applied here. And oftentimes they're extrapolating their personal experiences to other products that they've been involved with, thinking that's going to apply to this product.
Yeah, and it can be more complicated, and really people should take an eye at sort of separating out the investment part of it from the coverage part of insurance.
And I look at insurance, and I don't care whether it's automobile, homeowners, umbrella policies, whether it is life insurance, that I look to insurance companies to provide coverage, but I don't look to them to provide investments because they're paying commissions on those dollars being invested.
A big chunk of what you pay in premium will get paid out early on for commissions, and if you have some sort of cash value, there'll be a surrender charge that'll apply to it. So it's really not an ideal investment vehicle.
So, we don't have a problem with whole life products appropriately sold because they generate cash value, but I didn't buy the product for the cash, I bought it for the coverage.
Right, and the whole life is really great when you want to make sure you've got the coverage for your entire life.
Dave, as always, thanks for taking time to appear on the program.
Thanks, happy to be here.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just this simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.